KwaZulu, the health MEC in KwaZulu-Natal, has started speaking. Let's listen in.
The same, and therefore feel that we are not doing what we should be doing as government. And I do want to reassure the communities that the two diseases are two different diseases, and they manifest differently. But Ms. Babungile will then talk to us about that. I must say that I'm here today alone. I should ideally be with the MEC for Education, but because we have a meeting that has been called by the Premier, he couldn't leave that meeting, but Premier allowed me to come here. So I'm saying this because I want to confirm that I have permission from the MEC to be here with you today. Just 3 days ago on Saturday, as a province, we had 36 cases. Yesterday, the number stood at 168, but it has gone up by 27 to at least 195 infections overnight. All of these 27 new cases are from eThekwini District, which have added to the 120 cases that they had yesterday, bringing the total for eThekwini District to 147. eThekwini District is followed by King Cetshwayo District at 25 cases, UGU District at 20 cases, and uMkhanyakude District with 3 confirmed cases. Originally, last week, it was only in the eThekwini metro, and now over the past couple of days, we've seen the cases in other districts within the province. All of these 195 confirmed cases emanate from primary schools and daycare centers. And right here at Lenham Primary School, which is the most affected school in the province, we have at least 89 cases that have been confirmed. This is why we are here today, to see the situation firsthand, to offer our support to the school, to ensure that every possible measure is being taken to contain the spread of the disease. We have agreed with the management that we will provide support. We've also then made a commitment, because the second manager of education has just indicated to us that, in fact, there are other schools that are affected within the area. So we've then agreed that we will have a team that will be going around the schools in the circuit that will be testing learners. We are very much aware, however, that we need permission from parents for us to be able to do so. So the Department of Education will engage with parents to provide us with that permission, so that we are able to test learners probably on a daily basis in the schools that are affected, so that we are able and contain the spread of this disease. Hand, foot and mouth disease. It confuses even me. Hand, foot and mouth disease is a viral infection that spreads quickly among young children, especially in primary schools and daycare centers. It causes flu-like symptoms, painful blisters, and swollen hands. While it is not usually severe, it is highly contagious. The good news is that we can stop it if we work together. We have learned a lot from COVID, or during COVID-19 times, on the issues of hygiene. Again, the key point here in preventing of the head, foot and mouth disease is hygiene, hygiene, hygiene. As a province, we have faced several health threats before, including COVID-19, as I have indicated, and we've been able to overcome them. This we can also overcome. Now we must go back to the basics that helped us fight that pandemic. And those basics are frequent hand washing with soap and water, no sharing of utensils, cups, or toothbrushes, keeping classrooms and homes well ventilated, regularly disinfecting surfaces, toys, and stationery, and keeping symptomatic children at home. That is important, because if we don't keep symptomatic children at home and they come to school, then they get to spread the disease. So we are really making that call to the parents to say, please, let's look after our children, make sure that we are very observant of them, and should we have an indication that they might be infected, let's keep them at home. You can go to a doctor, but you certainly can come to our facilities as a Department of Health. We are ready, and we will be able to deal with the situation. These simple, powerful actions can help us contain the situation before it gets worse. I want to thank the teachers, school staff and parents who have already taken steps to protect our children. I am aware that in this school in particular, with the first children that were discovered around the early in the month that they were infected, some of them are already back at school from isolation, and that was as a result of the teachers and school staff that was proactive and was able to pick up the matter and send the children back home. The vigilance, or your vigilance, both as parents and as educators, is critical, but we need to do more. Every school, every home, and every community must take this outbreak seriously. To parents, please, if your child shows symptoms, do not send them to school. We want to emphasize this. If your child shows symptoms, do not send them to school. To the teachers, continue educating our children on hygiene and take extra precautions in your classrooms. And to all our healthcare workers, thank you for your tireless efforts in managing this outbreak. This is not a time for panic, but it is a time for action. Let us not allow this disease to take hold, and the best way to ensure that it actually doesn't get hold is for us to be vigilant and make sure that hygiene is adhered to. By working together, staying vigilant and prioritizing hygiene, we can protect our children and prevent further infections. I assure you that we as the Department of Health will continue to monitor the situation closely and provide all the necessary support. In conclusion, I also want to say to community members, please do not be worried. We are here, we are ready. Yes, we have that outbreak, but the best way to manage the outbreak is not to panic. The best way to manage the outbreak is to make sure that we watch our children. If there's a child that you see symptoms in a particular child, don't send that child to school. Bring them to the Department of Health, and we will indeed be able to assist you and get the child back on earth in a very, very short space of time. What is also good about isolation here is that the child doesn't have to be away from school for more than 10 days if they have been found to have the disease. So it is very important that we pick it up very earlier on so that we are able to deal with the fallout thereof. I then will request Ms. Mabongile to just give us a difference between the two, and then we can take questions should there be any.
Thank you, MEC. In terms of the hand, foot and mouth disease, as MEC has said, is a viral infection that is transmitted from one person to the other, and it's not the foot and mouth disease that we know that normally affects cattle and other animals, because this hand, foot and mouth, it's not zoonotic, meaning that it cannot be transmitted from humans to animals, and vice versa, from animals to men. So it's a different disease, and as MEC has said, it's a very mild disease, and what makes it a bit different from others, it's the fact is the blisters that are normally found around the mouth, on the sides of the tongue, on the palms and underneath the foot, which makes it difficult for the kids to actually swallow, to actually hold anything and walk properly because of the blisters that are on the soles of the feet and on the hands. So we just want to clear that we're really urging community to differentiate between the two, that foot and mouth, it's a disease that affects animals. And this one that we are referring to today, which is hand, foot and mouth, it's a human disease that doesn't even affect animals. Thank you.
All right. Thank you very much, colleagues. We will now take the questions from the floor. You raise your name and the institution that you come from, or the media house. Thank you very much. Yes.
Thank you, MECJ from the SABC. You spoke about some of the districts. I just wanted to find out, are you finding clusters in those districts like uMkhanyakude, or are there sporadic spreads? And are there any rural schools that have been affected? The second question I have is that we do know there's a challenge of water in eThekwini. Just looking at infrastructure at some of these schools, are they equipped with practicing this good hygiene that you speak of? Thank you.
Thank you very much. Maybe let me just respond to that, then we can take another question. The first one, are we finding clusters? eThekwini, for instance, yes. it is a cluster because we see the infected schools are around one circuit, as the Department of Education calls it. uMkhanyakude, again, it's also in about one school. So you find that there are clusters, in fact, even in the other district. Are there rural schools that are affected? Yes. There are rural schools that are affected. What we've been unable to get a sense of is patient zero, because it sometimes helps to be able to pick up who patient or where patient zero came from, because then we are able to follow the disease. And the department has been busy together with CDC to try and establish patient zero. But while we've not been able to get there, again, we get to speak on the issues of hygiene. Other challenges of water in eThekwini, certainly there are. I'm not sure how the school is affected. I think that we can give that to the principal to respond to. But in terms of our own facilities as a Department of Health, we have had challenges, as we have seen in Prison Mshini a few weeks back. However, as a result of the engagement that we had with eThekwini Metro after the Mshini challenges, we then came up with a plan with the Metro on how they are going to assist our other hospitals and clinics that don't have water, should the situation or should the need arise. I was informed in that meeting by the Metro that it's not all hospitals and clinics that will not have access to water at the same time. Apparently, there's a water shedding schedule that they have. So we then agreed with the Metro that they need to inform us of the dates and the times of that water shedding, so that we are ready as a Department of Health and we have our plan B in place. But they themselves, as a Metro, needs to be involved in the plan B of provision of water in our different facilities. But in terms of the school, I would not be privy to that information. Probably the principal can speak to that.
Want the answer from the principal?
Okay. Good morning. Good morning.
Covered. Okay. I'll come back for a second, right?
Sorry, is the principal not responding to the issue of water?
Oh,
Yeah.
Good morning. We don't have.
Can I take it? Sorry, just a minute.
We don't currently have an issue with water. We have been getting an active supply of water. Last week we did have a burst pipe at the top of the road which needed repairs, and for that reason and due to the infections at school, we did decide to ask parents to fetch learners home and take them home. So that did assist us.
Thank you very much. We'll take a question.
Is it an option to have the school closed for a few days for fumigation and cleaning or any sort of sanitization, and then the children come back and go to some of the parents? They're asking and calling for that. Is that an option that can be put in place?
Well, the Department of Education will make that call, but as the Department of Health, we don't advise it. We don't think it's necessary, because you just need to pick up symptoms from learners, and then those learners can be isolated at home. That is why when we had an engagement with the management of the school and the second, one of the things we agreed on is that the principals, when they come to school, the first thing that they must do is conduct an assessment on a daily basis. And once they've done that, then they call us directly through the district director to say, after our analysis and assessment, we have found 5 learners, we have found 10 learners, we've isolated them, and we have called the parents. Can you, as a Department of Health, also come? So that when we are there and parents allow us, we are then able to take the kids to our CHC and be able to provide the treatment that is necessary. But we don't advise on closing of schools. We don't think it's necessary at this point. Which is why earlier on, I think it was before you came, I was calling for calmness within the community, because I did get a sense that community is now becoming a bit agitated, which we understand, and that is why we then had to explain the difference between the hand, foot, and mouth that our children are exposed to, and the hand and mouth in
Hand, foot, and mouth.
No, what's the one animal? Foot and mouth disease. So ours is hand, foot, and mouth. then there's a foot and mouth that is in animals, and it was clearly indicated that it is not cross-transmittable between the animals and the humans.
Thank you. I'll come back to you again.
MEC, just another question from my side. We do know that clinics are inundated with patients. When we speak about the spread of hand, foot and mouth, I imagine that a mother that goes to the clinic with her child will be catered for first. Will there be a specialized department or room that will be looking after cases such as hand, foot and mouth to curb the spread within clinics itself? Thank you.
Jay, what we decided to do, particularly where there are clusters, which then also helps, is that we are going to have our school health teams roaming and visiting schools almost on a daily basis. That's the first point. But when parents bring learners to clinics that are suspected to have this disease, indeed, we will then prioritize them and make sure that we have a particular queue. And they are treated quickly because remember, in as much as a clinic itself is meant to cure, but for as long as we are sitting in a queue, we are also exposing other children, or they would be exposing other children who are there who might not necessarily have. We will have a system that prioritizes those that are suspected of being infected.
Thank you. I saw another hand. I'm coming to you. Your hand up. Oh, got you.
My name is King with SABC Radio News. Madam MEC, is there any mechanism between Department of Health and Education to work together so that everybody is on the same page? And by that I mean practical measures. You mentioned now that here in this circuit we've worked out the system. The principals check first thing in the morning, isolate, phone the figures through. I'm thinking of maybe other types of practical measures that's like open, that one person can see it one way, another one can see it another way, like the sanitization of, the sanitizing of classrooms, or like learning materials. Practically, when can a child come home? This morning we heard from one parent they're being asked for medical letter. Another principal might say, as soon as the parent sees there's no symptoms and a certain period of change have passed, then they can come back. So is there a mechanism that form a link between the two departments on this issue?
I'm trying to pick up what practical plan are you talking about so that I respond to that directly.
What I'm saying is Department of Health and Department of Education working together so that we have one practical plan in place everywhere to curb the spread?
All right. Working together between the two departments would not be starting today. We did that during COVID, and we had a plan that was working very, very well together. That is why in this session now, I have a district director of health and the second manager of education, because they are the ones who are going to be implementing on behalf of both departments a plan. Now, one of the plans is this plan that we are talking about. Once we see a cluster moving to a different area, the same plan that we've agreed on will then be implemented in those clusters, because you can't just have a blanket plan at this point. You can't just have a blanket plan that affects the whole metro, because it's not the whole metro at this point that is affected. So the people that are responsible for implementing are here, both of them, from the Department of Education, from the Department of Education, from the Department of Health. They are the ones who we've agreed on the plan, and they are the ones who are going to make sure that the plan is implemented. Like I said, the plan is not just for the school.
The health MEC there in KwaZulu-Natal speaking about the outbreak now as it being described of the hand, foot and mouth disease. 195 cases picked up so far and counting, it seems. We'll get you a sense of how else the department is responding to that.